Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Etiology of genitourinary tuberculosis. The route of infection of genitourinary tuberculosis is by hematogenous route. Okay. The route of infection is mainly by hematogenous route from the lungs. So, main etiology of genitourinary tuberculosis is the route of infection is by direct hematogenous route from the lungs, and there is primary site of infection. At the primary site of infection is not symptomatic or it is apparent. Mostly in the first site where the infection occurs, that is most of the times it is not symptomatic. Then from there the tubercle bacilli will lodge into the periglomerular capillaries. The capillaries present around it, the tubercle bacilli will lodge in these periglomerular capillaries, and they form cortical granulomas. They will form cortical granulomas mainly after the hematogenous spread. So first they lodge in the periglomerular capillaries. From there they go and form the cortical granulomas. So these cortical granulomas will contain the dormant bacilli. Okay, so in the cortical granulomas we find dormant bacilli. These dormant bacilli are stable and they can multiply years after producing the disease. Like for example, now if the patient develops disease after years after producing the disease, these bacilli may multiply and they can cause recurrence of the disease also. So these dormant bacilli are actually responsible for recurrence of the disease. Then spontaneous healing can also occur usually in these cases. Okay, then this development of the disease in the genital tuberculosis mainly depends upon two things. One, interaction between the pathogens, and then immune response of the host. If the interaction between pathogens is if the pathogen is strong and immune response of host is weak, then disease develops. If the immune response of host is more than the parasite, then obviously the disease cannot develop.
thank you and thank you for watching.